Marlena. I'll be doing the basic IV insertion today. So the first thing I'm going to do is implement my standard protocol. So I'm going to assess the type and duration of IV therapy as ordered by the physician. I'm going to compare my doctor's orders to the MAR. I'm going to assess the patient's lab data and history of allergies, and I'm going to identify the size catheter I need according to the plan. So today I'm going to use a 20 gauge catheter. So next I'm going to prepare my equipment. So I'm going to use aseptic technique when I'm doing it. I'm going to go ahead and wash my hands. I'll go ahead and prepare my tape, which is right here. I'm going to put on my gloves. Going to check the expiration date. Okay, May of 2016, that's good. And I'm going to clean with an alcohol wipe the tip. Okay. I'm going to get my 2 milliliter syringe, attach the needle to it, draw up 3 mLs. Pull back 3 mLs of normal saline. Get out any air bubbles. Okay. This will go in the sharps container. I'm going to attach it to the needleless INT extension tubing, and I'm going to prime it. Okay, get out any air bubbles. Leave that attached. Okay, so next I'm going to take my gloves off. Go into the patient's room. Hi, I'm Marlena. I'll be your student nurse today. I'm here to insert an IV that your doctor has prescribed. Can you state your name and date of birth for me? They tell me. I'm going to compare it to their wristband. Are you right-handed or left-handed? They'll tell me they're left-handed. So I'll do it in their right arm if they haven't had a mastectomy or any shunts or fistulas from dialysis. Do you have any allergies? No? Okay. So when selecting a vein, I'm going to choose the most distal site in a non-dominant arm if possible. I'm going to choose the arm that won't interfere with the client's ADLs. When palpating, they don't want to feel any pain. And then I'm going to note the resilient, bouncy, soft feeling. So that's good. So next, I'm going to wash my hands, apply my tourniquet 4 to 6 inches above the insertion site. Okay, I'm going to palpate the radial pulse that's present. So next I'm going to apply my gloves. I'm going to get an alcohol pad and wipe in a circular motion, starting from the insertion site and working my way outward. Okay, so now I'm going to stabilize the vein by pulling the skin taut in the opposite direction. I'm going to get the catheter, I'm going to warn the patient of a quick stick. Going to put it in at a 15-degree angle, double up. When I see flashback, I should see flashback, and then I'm going to lower the catheter and put it in another 1/8 to 1/4 inch. I'm going to loosen the stylet and then push the catheter in until the hub rests at the venipuncture site. Then I'm going to apply pressure, take out the stylet, release the tourniquet, and then grab my INT extension tubing and connect it to the hub. Unclamp my tubing. I'm going to pull back. I should see blood return. Then I'm going to flush it with a normal saline. I'm going to clamp my extension tubing. Okay, and then I'm going to remove the syringe. So I will get my my transparent dressing. Put it over the hub. Okay. Remove this. Okay, and then right here, I'm going to put the my initials, the date, the time, and then the catheter gauge length and size. I'm going to put it away from the insertion site, but where it's visible to read.
Is this a classroom?
Okay, so now I'm going to grab my tape and tape this away. Okay, so now I'm going to do my completion protocol. So I'm going to assess, see if there's any pain, swelling, redness. I'm going to make sure that the bed is down properly, make sure they have all their belongings, and make sure they don't have to use the restroom. And then after I do that, I'm going to throw all of my uncapped needles and my stylet in the sharps container, and then I'm going to document the time and date I did my the insertion size, so right forearm, the size and the type of catheter I used, the number of attempts, which would be 1, the patient's response, the patient tolerated it well, and then any instructions that I gave the patient.